Can problems and pain with your shoulders be prevented? Does treatment have to mean surgery? Dr. David Nonweiler, Central State's orthopedic specialist, recently sat down with us to talk about shoulder injuries and how he can help. Just talking about get to a certain age, things start to happen, whether shoulder, knee, it's just inevitable, isn't it?
Yes, unfortunately that's true. That's one of the advantages of being a little bit older, having a little bit more experience, is sometimes some of those body parts start to bother you. And one in particular that bothers you is your shoulder. And I'd like to tell you a little bit about some problems in shoulders and how you can kind of prevent those shoulder problems. If you look at a shoulder, this is the roof of the shoulder, and there's a set of muscles around the shoulder called the rotator cuff muscles. There's a spur that typically grows down along this ligament right here. And so as you get older, you get more of a spur here. And so the space between the roof of the shoulder and the rotator cuff will narrow. That's not a problem until you start reaching out away from your body. And as you reach, this space here between the rotator cuff and the roof narrows. And so you pinch and rub and irritate that rotator cuff. And so that bothers you if you are doing weights away from your body. If you've decided you're going to get active and you start doing shoulder exercises away from your body, that tends to start creating shoulder pain. You may also have pain when you reach up to put the dish in the cupboard, or if you reach up to hang clothes on the hanger in the closet. Those may bother you.
How can one tell, though, the difference with whether it's a rotator cuff injury or if maybe it's just we're pinching something?
The duration, primarily. I mean, if every time you reach up to hang that hanger in the closet, your shoulder hurts and it's done that for 2 or 3 months, it's probably not just a strain, it is your rotator cuff, and that's the point where we would recommend that you see a doctor about the treatment for that.
Okay, and I think a lot of times too, you just think a fitness program might work, maybe I can work it out, but if it is a rotator cuff, you're probably beyond doing that, and that's where you need to come in?
Well, fitness programs are important, and we want you to stay fit, we want you to stay active, but there are certain types of programs that are better for certain age people as opposed to others.
Is that why they always say consult your doctor before you begin any kind of fitness regimen?
It's certainly a good idea for that reason, but they're also concerned about cardiac issues and concerned about your heart. You want to be sure that from a general medical standpoint, your heart's strong enough for you to exercise.
Okay, and if we do think it's a rotator cuff when we come in, is it pretty much going to be a surgical matter, or is it just...
Not always. Most of the time, people have rotator cuff inflammation and irritation, and it's not actually torn. And so if we'll stop you from doing certain activities that are irritating it, such as in an exercise program, we'll change your workout program, about 70% of people will improve non-operatively, so long as the rotator cuff is not torn. That's why it's important, though, to see your doctor, because if you keep delaying this, kind of pushing that to the back burner, continuing your exercises that irritate the shoulder, you can eventually tear that rotator cuff. Once it's torn, then yes, that's something that has to be fixed surgically. That rotator cuff tear won't heal on its own.
All right, some good information. Thank you, sir.
Thank you.
Appreciate it.
All right, my pleasure.
Central State's orthopedic specialists. They're located at 6585 South Yale Avenue, William Medical Building. And you can find out more by going to Central State's Orthopedic Specialists, or csosortho.com. That's 481-2767 is the number to call.